Most men over 60 ask me the same thing quietly, almost like it's something they're not supposed to talk about. How often should sex even happen at this stage of life? And is it normal that it doesn't feel the same as it used to? That hesitation matters because silence creates confusion and unnecessary worry. Today we're going to talk about this clearly and honestly, not with exaggeration, not with shame, and not by pretending aging doesn't exist. We'll explore what's realistic, what's healthy, and why focusing on numbers often distracts from what truly matters. Stay with me, because partway through, you may find yourself rethinking how you define sexual satisfaction altogether. I'm Dr. Zara, and I work with men navigating health and aging through biology, psychology, and practical understanding rather than unrealistic expectations. These conversations are important because clarity replaces anxiety and knowledge restores confidence. Let's start with what actually changes as men grow older, because understanding what's happening inside your body is far more useful than fighting it. One of the biggest shifts involves hormones. Testosterone naturally declines with age. This hormone influences libido, energy, and erection quality. The decline is gradual, not sudden, and it doesn't erase desire. It simply changes how desire shows up. You're not broken, your body is adapting. Another major factor is circulation. Erections depend on healthy blood flow, and blood flow is influenced by cardiovascular health. Conditions like high blood pressure, elevated cholesterol, or diabetes can slow circulation. As a result, erections may take longer to develop or feel less firm. That's not failure. That's physiology responding to real conditions. Medications also play a role. Many men over 60 take prescriptions for heart health, blood pressure, or blood sugar control. Some of these medications can affect libido or erectile response. In many cases, small adjustments or alternatives can help, but those changes should always be discussed with a medical professional rather than ignored or endured in silence. Then there's the psychological side, which is often underestimated. Many men compare themselves to their younger selves. That comparison creates pressure, and pressure creates stress. Stress interferes with arousal more effectively than age ever could. When the mind is tense, the body follows. So what's normal when it comes to frequency? There is no universal number. Studies suggest many men in this age group average once or twice a week, but averages don't define individuals. Some couples are content with less frequent intimacy, while others prefer more. What matters most is that both partners feel satisfied and connected. Alignment matters more than frequency. A common concern I hear involves duration. Many men worry that shorter intercourse means they're failing. In reality, penetration time tends to decrease with age, but intimacy does not. Touch, anticipation, kissing, closeness, and shared presence often become more meaningful than the act itself. Minutes do not measure intimacy, connection does. If you're unsure whether you're doing too much or too little, your body and your relationship will give you clues. Feeling exhausted, dizzy, or physically strained afterward is a sign to slow down. Emotional distance or lack of closeness may be a sign that more intentional intimacy is needed. Balance is the goal, not extremes. Now let's talk about what actually supports sexual health after 60. Movement is one of the most powerful tools. Something as simple as daily walking improves circulation, supports heart health, and boosts energy. Consistent movement directly supports erectile function. Nutrition matters as well. Foods rich in omega-3 fatty acids, zinc, and essential nutrients support hormonal balance and blood vessel health. Hydration is often overlooked, but dehydration reduces energy and desire. These are not complicated changes, but they are effective. Smoking constricts blood vessels and directly interferes with circulation. Alcohol, especially in excess, dulls the nervous system and reduces sensitivity. Sleep is when your body repairs itself and regulates hormones, including testosterone. These are not moral judgments, they are mechanical truths about how the body works. Mental health is just as important as physical health. Open communication with your partner reduces pressure and deepens trust. Silence creates distance. Relaxation lowers stress hormones and improves responsiveness. Practices like deep breathing, mindfulness, or gentle stretching can have real benefits. Some men ask about supplements or medications. Certain vitamins and minerals may support overall health, and prescription medications can be helpful for some individuals. However, it's critical to never combine erectile medications with nitrate based heart drugs. That combination can be dangerous. Always consult a healthcare professional before using any medication. Does having less sex harm your health? Not directly, but regular intimacy can support better sleep, emotional well being, and immune function. Can too much sex be harmful? Only if it ignores physical limits or underlying health conditions. Sex does not stop at a certain age, it changes. Some men remain sexually active well into their 80s. Others slow down earlier. Both experiences are normal. Aging does not remove the capacity for intimacy, it reshapes it. What causes the most damage to sexual health after 60? Poor sleep habits, excessive alcohol use, ignoring chronic conditions, and isolation. Loneliness and depression reduce desire by altering brain chemistry. Staying socially connected and emotionally supported matters. Here's the truth: sex after 60 is not a competition with your past, it's a collaboration with your present. When you care for your body, respect your limits, and stay emotionally connected, intimacy remains deeply satisfying. Aging changes the rules, not the reward. Take care of your health, take care of your relationships, and take care of yourself.